Okay, so we're going to spend the day talking about poo and pee. So everybody say those things with me. Poo, pee. Good. Now, got that out of your system. I mean, we could talk about urination and defecation, but frankly, it's more kind of down to earth to talk about poo and pee. So, and you know, this is a somewhat distasteful topic on the one hand. On the other hand, it's a really important topic. Kids and teenagers and adults who aren't toilet trained face a number of disadvantages in the world, both in school and in the community. And so it's a really important thing to accomplish, especially for those of you who work with very young kids. Your goal absolutely needs to be to have kids toilet trained by the time they enter kindergarten. I'm going to start with some sort of basic framework around toilet training, and then we're going to talk about two different ways to approach the task. So let's start with some myths about toilet training. Some of my favorite myths. This one comes up all the time. He's too old to be trained at this point. That's not true. How many of you are concerned about someone who is older than kindergarten age and is not yet toilet trained? Yes, okay, so that's good. I'm glad you're here. It's not true that if somebody hasn't been trained by the time they enter kindergarten, it's not possible to do. To be honest, it's more difficult the older someone is, right? 3 is easier than 4, 4 is easier than 5, 5 is certainly easier than 18. But it's not true that people can't be trained. It's just got to be planned and systematic in a different kind of, in a more focused kind of way. So I'm glad you're here if you're concerned about someone who's older. Another one that I hear all the time is, you know, she can't be trained, she has, you know, whatever, XYZ syndrome. Fill in the blank here. I mean, I don't know of any relationship at all between particular diagnoses and an inability to be trained, with the exception of, you know, for example, kids with spina bifida who have what's called a neurogenic bladder. That is, their bladder literally isn't connected neurologically to their spinal cord very well because of the spina bifida, and you know, they don't have any feeling in their bladder. But this happens rarely, and I would doubt very much that any of you here are supporting individuals who have that disorder. So don't let the diagnosis get in the way, and please don't also let the level of cognitive impairment get in the way, right? Oh, he's too profound, people will say to me, to be toilet trained. He's only got the mental age of a, I don't know, 10-month-old. I don't care. He can be toilet trained. He can be toilet trained, okay? He'll train himself when he's ready. Yeah, how's that working for you? I mean, sometimes that's true. Certainly for some typically developing kids, that's true, you know. But frankly, if it hasn't happened yet and it doesn't look like it's on the horizon, like he's not pondering this, the likelihood that he's going to wake up some morning and go, you know, should have gotten toilet trained yesterday is really slim. So let's not wait around. We need to actually do something about this, not wait around and hope that someday he's inspired or she's inspired. And then the last one is he or she doesn't have the necessary prerequisite skills. This is probably the one that I hear the most, and therefore my least favorite, because I think it gets in the way of people moving forward, because they're looking for prerequisites, which actually don't have to exist. So some of the prerequisites that people talk about, and again, it depends upon who you ask or what book you read, are things like the person has to be able to stay dry for at least 2 hours at a time. You know, it's harder work if the person can only stay dry for an hour at a time or for a half an hour at a time. It's more work to do it, but it can be done, so that's not a prerequisite. Having a regular bowel movement schedule is as much a matter of diet and exercise as it is of anything else, so we'll talk about that when we get to the poo part. Following simple directions, no, you don't have to be able to do that to be toilet trained. Demonstrating discomfort with dirty diapers. Most kids with autism and many other developmental disabilities are used to the dirty diapers or the wet diapers. I mean, they think that's where they're supposed to be doing all of this, right? Because that's where they've always done it. So they're not going to get squeamish about it. It's like, this is very familiar feeling. I know how this feels. Ooh, it's warm in there. Okay, right? So don't start looking for that as a sign that he's ready. Asking to use the toilet, well, wouldn't that be nice? Asking to wear underwear, well, wouldn't that be nice? Mommy, I'd rather not wear diapers. Could you buy me a set of underwear, please? I mean, I don't think that's going to happen. Pulling pants up and down independently. Why would he do that if he's in diapers? He doesn't know how to do that yet. Nobody's taught him. So again, there are many, many prerequisites that people kind of talk about. Some of these things are nice if they can happen, but they're not necessary. We can work around this stuff. Now, if you go to your local, I don't know, Amazon.com and look for toilet training, there's two main approaches that you're likely to find if you want to buy a book. The first one is the Brazelton way. This is named after a very famous pediatrician named Barry Brazelton. You can buy his book on toilet training, The Brazelton Way, and the goal in this book is for the child to think that potty training is his idea, not the adult's. So this is all framed around giving the child autonomy and choice and so forth and so on. And some of the strategies in the book are things like you take the child to the store to buy a potty together, you encourage the child to sit on the potty fully clothed so he can get used to it, you empty the child's soiled diaper in the toilet in front of him so he understands where the poo goes at the end of the day. And then having done all of these things, the child will be drawn into the bathroom and will be sitting on the potty, and he'll want to do this. He'll think it's his idea that this all happened. And of course, if at any point in time he reacts negatively, we're to pull back and not push him because it will damage his fragile ego. And everything has to occur at the child's pace. And, and that's swell. I mean, it's all lovely. And for many typically developing kids, obviously he wouldn't be publishing the book and selling it if it wasn't an effective approach. And it is an approach that's endorsed by both the American Academy of Pediatrics and the Canadian Pediatric Society. So, to some extent, at least, it's an evidence-based approach for typically developing kids, right? For typically developing kids. But we're not talking about kids who appreciate that kind of model of toilet training. I think it's my idea. I'm keen to do this. It will please my mommy and my daddy and blah, blah, blah. We're not necessarily talking about kids who are attuned to those kinds of ways of thinking. So this has despite the endorsement, has its downsides. And I'm sure that some of you have tried the Brazelton way, and that's why you're here today. The other thing that you're likely to find is Dr. Phil. Dr. Phil's Potty Train Your Child in One Day. Oh boy, let's buy Dr. Phil. Dr. Phil's method in a nutshell is get a doll that pees, make the doll pee in the potty, get really excited, suggest that your child give it a shot, and then get really excited when your child does what the doll did. Like I said, how's that working for you? Right. Which is, again, all very nice, but Dr. Phil's never met your son or daughter or client, because if you've tried something like this, that's why you're here today, right? So toilet training isn't something that is a suggestive behavior. We don't just suggest to the child that he might want to pee in the toilet because that's how daddy does it, or that's how mommy does it, or that's how the doll does it. And he picks up on that. When we've got kids with significant learning challenges, we need to do more than just suggest. What we need is good instruction. Toilet training is all about good instruction. Toilet training is a teaching procedure, not a suggestive procedure, not an idea, right? So if teaching is involved, there's got to be a teacher, that would be you, and a teachee, that would be the kid who you want or the person you want to toilet train, Okay? And what I mean by good instruction is instruction that's carefully sequenced, systematically planned, and systematically executed and delivered. Right? So we've got to get very organized here, very thoughtful, and we've got to start the instruction where the person is at, right? I'm not going to start up here if the person is down here in terms of his skill level, but I'm not going to start here if the person, right? So I need to figure out where is he at with regard to this toilet training enterprise, and I'm going to start there. So that's one key thing that we're going to be talking about for sure this morning, is starting where the person is at. The other thing that the toilet training as good instruction is instruction that employs appropriate motivational incentives and error correction feedback. You will get tired of hearing me say this today. I guarantee you will get tired of emphasizing how important this is. If you don't have appropriate, strong, motivational and error correction feedback, you have nothing. So we're going to spend a lot of time talking about that, right? The number one reason when people ask me about toilet training, the number one reason that it's not working is because of motivation for the kid. So we've got to up the ante on the motivation. So today we're going to be actually talking, one of the reasons that I was quite keen to revisit this topic of toilet training, because as Deborah said, I did an online video for ACT several years ago on the topic, is that what's different about today's presentation is we're going to talk about two ways of doing this, two approaches. I'm going to talk about what I call the long way. Okay? The long way is a not intensive approach that occurs throughout the day over several weeks, right? So I've got a child or an adolescent or an adult who has a life. He goes to school or she